Hello friends, today we have brought the second part of this series, that is, your child has reached 8 weeks from 4 weeks, that is, his second month has started. As I had told you last time, from your last menstrual period, that is, your last period, till the next period, until he misses it, the child becomes 4 weeks old. According to you, it may not be 4 weeks old, according to you, it may be only 15 days or 10 days old, because you count from sexual activity, we count from your last period. So if your period came on the 1st of March and by the 1st of April, if you missed your period and you took a positive test, then at that time the child is 1 month old. Now we talk about the child reaching the 1st of May from the 1st of April. That is, the second month. What changes have occurred in the child in this entire second month? I had told you that within 4 weeks, that is by the time the period is missed, the heart of your baby is formed and the heartbeat starts, which is visible after 1 or 2 weeks, because sonography cannot pick it up so early. Also, in the second month, he has small ears, nose, eyes, some ears, some nose pimples, some limbs, so a very tiny baby is born. Inside which small birds start coming out, like the birds come out of plants, okay? What changes take place inside you? Now, as I told you last time, that initially after the first misty period you don't feel nausea or vomiting, because it takes time for the hormone level to increase. Gradually your hormones increase and the main culprit is HCG. When HCG starts increasing, around 8 weeks, the ovary in your body from which the egg came out was producing all the hormones till now. Because 8 weeks have passed, 2 months are ending. So within these 2 months a change takes place, this ovary's work is over, it ends now, gradually the placenta starts doing all the work, that is. The placenta also becomes quite big in 4 weeks to 5 weeks. Its work starts after 8 weeks, that is, around 2 months. After 2 months, all the hormones start coming out from inside it. HCG, progesterone, which I told you about last time, now the umbilical cord will make all these. Now because the umbilical cord has started making all the hormones and the level of these hormones is increasing, then now you will start feeling nauseous. That is, you will feel like vomiting. You will smell food after eating or after seeing food. You will not feel like cooking, spices will smell. This is very common. It is not necessary that you have to eat only homemade food in pregnancy. Whatever is being prepared at home, if you want to eat something different, it is called pica. Pica means that in pregnancy there are some different altered sensations, altered demands of the body that we have to eat something else. Some different type of altered demands, you should fulfill them, definitely eat healthy food if you want to eat outside. Many people eat burgers, many people say, can we drink cold drinks? It is a very common question, can we drink green tea? First of all, do not try to reduce in pregnancy, if you have become pregnant and are continuing pregnancy and your weight is more. You are overweight, OBG, now is not the time to reduce yourself, because now the child will be born. It is in the stomach, you have to take care that your weight does not increase more than 8 to 10 kg. In normal pregnancy we say 12 to 15 kilograms weight because you are already overweight, so to keep your weight within 10 kilograms, you have to take care that you do not take too much fatty things because there is already a lot of fat in the body. Okay, so basically we are talking about, you are vomiting in the second month, whatever you feel like eating, eat it healthy, should be clean even if you are eating outside food, it should not be too spicy food, you get tired so resting is necessary. Little exercise means, walking is necessary. Okay, now as you heard last time that uterus is growing, so uterus will definitely grow more in the second month and you will feel like urinating more frequently. You did not know it in the first month, but you will know more in the second month, because now the uterus has become almost like a cricket ball and then a little bigger than that. So now it will put pressure on the bladder and you will feel like urinating again and again. Along with that you will have some gastric bloating because you are having nausea, you are not feeling hungry. Whatever you have eaten is not digesting or you are not able to eat at all, so bloating happens. Gas is formed and some people also have constipation. Constipation either increases if you had constipation from the beginning or you never had constipation before and now constipation has started. The reason is the hormone progesterone. Because of progesterone, the muscles in your body, the intestines, stop moving and they relax. We call this peristalsis, that is, the movement is called peristalsis. If there is no peristalsis, then you will not pass stools, you will feel constipated, you will vomit, and you will have more gastric bloating. So gaseous symptoms are very common, especially in those people who are already prone to gas, who already have digestive problems from the beginning. The third organ that will change is your breasts. You will feel a tingling sensation inside the breasts because the nipples inside the breasts are very sensitive. Plus, milk ducts start forming inside the fatty tissue inside your breasts, so due to the formation of milk ducts, the size of the breasts increases a little. You feel a different sensation inside the breasts. You are also feeling a little pain. Sometimes there is tingling also because everything inside starts growing. In some cases, small pimples start appearing inside the areola. That is, the black part around the nipples. Although they do not appear so soon, these changes are seen quickly in ladies who have already conceived and breastfed a child. That is, the small pimples on the black areola, which we call Montgomery tubercles, are nothing. They are neither pus nor pimples. They are simply milk ducts, they are tubes, the mouths are visible. So this is what changes will come in the second month in these 2 months. Now what should you not do? As I told you, do not eat to your stomach, do not take too much. Rest, that I am pregnant, I am ill, I will keep resting. Work as much as the body can handle. Do not overload yourself that you are doing everything. If there is a small child in the house, avoid holding him in your lap because there is already a child growing in your womb. Many people make the mistake of feeding a small child. Now that child is 2-3 years old, you are still feeding him milk. And the second child is already in the womb or you have conceived very early. The first child is just a few months old, 8 to 10 months old, and you have conceived, then gradually stop the milk of the first child. Firstly, I have told many times that after 1 year, when the child's teeth start coming, you already start feeding rice and roti to the child at 6-8 months. Then the mother's milk is not needed. When the mother feeds the child after 1¼ years, then changes start coming inside the mother. Her menstrual cycle gets disturbed and the child becomes so much attached to the mother that he does not eat anything extra. Then his health starts deteriorating. So firstly, if your second month has come, you will feel tired, you should rest. Do not rest so much that constipation and gas are formed. Do not hold the child in your lap and do small situations. It is okay to divide the meals. Rest is very important because I am saying this, because many ladies will do all the work and everything and will wait for their husband.